have been warning against this for many months now, what we call vaccine nationalism. We really believe that the best way forward and the most just way forward is to vaccinate priority groups all over the world at the same time. Because if we really want to open global economy, and we all want to do that, it's not going to happen country by country. We need really to suppress the virus everywhere, make sure if we vaccinate groups, priority groups in every country, that will take off the burden from hospitals in many countries. That will help us get back to the normal lives. We have put in place what we call COVAX facility, that we invite all countries to join, to put money in. So we collectively buy vaccines from different manufacturers as vaccines are coming in, and we try really to distribute those vaccines in an equitable way. Many countries have signed for. We are now looking into data that are coming from different manufacturers for WHO emergency use listing, and we hope that we as collectively can show solidarity and can show that we can work together to end this together.
Now, what's the World Health Organization's estimate in terms of what the pandemic will look like in 2021 in comparison to 2020 now? And I guess in light of the vaccines coming out, what are the expectations for this year to come?
Well, we all want our lives back to some sort of normality, and we understand that people are tired, but it will take some time. Vaccines will be coming, but will be coming slowly, and we will not be able to vaccinate everyone quickly. So we need to rationalize the use and protect those who are most vulnerable first. For the rest of us, we still need to do the same things that our health authorities in different countries were asking us to do, to follow measures, to try to make the risk to exposure, to the risk to infect others as reduced as possible. So basically we cannot just be complacent now because there will be a vaccine. So as we were saying, there is the light at the end of the tunnel, but this tunnel it is quite long, so we need to go through this tunnel, and during that period we need to be patient and to follow instructions and try really to do what we can individually but also collectively to suppress the virus and try to slow down the transmission.
Now, looking at the world as well, we saw what appeared to be more effective restrictive measures in certain parts of the world, such as in Asia, East Asia versus parts of the West, but we also saw just the sheer infection rates differ greatly. For example, from the West to the Middle East, across Africa, it appeared that the Middle East and Africa specifically were less affected by the virus here, at least less hard hit by the outbreak. Why is that? What's thought to be behind what appears to be less of an outbreak in those continents?
Well, to answer your first question, obviously, when we were talking about knowing where the virus is and trying to stop transmission chains, that's exactly making sure that people who are infected and those who have been in close contact with them are isolated or quarantined for 2 weeks. Some countries were doing better in enforcing this, making sure that people really follow the instructions and really stay at home for 2 weeks, and that the tracing system works, that once we have infected person who says that he or she has 10 contacts, these contacts are then informed and followed upon. We also need to make sure that people, if we are asking people to stay at home for 2 weeks, that we can provide them for living for that time. Many people cannot afford to stay at home 2 weeks because they need to earn their wages. So we need this system in place, and some countries were really doing good in that, and they were able to suppress, as you mentioned, many countries in Asia. Now, when it comes to different infection rates, there is obviously issue of testing, and we know that in many parts of the world. And all countries were initially looking only into severe cases because these people come to the hospital and you count them. But there are many more unreported cases and many more unreported deaths in different countries. And there's no country that were able really to have exact figures, but you may also have other factors like average age of population that would mean that many asymptomatic places are not accounted for because simply they are not tested. But definitely the pandemic has hit every country at some point, maybe to various degrees, but solutions have to be collective and not individual.
I want to get your thoughts on some of the more political things we've seen play out with the World Health Organization. You know, the Trump administration in particular leveled harsh accusations at the World Health Organization in the midst, at the height, arguably, of the pandemic here, talking about being beholden to the whims of certain countries, namely China. But is there effort underway now to mend the rift with the United States here, to get more of the funding back? In other words, move on or address even some of those political accusations and issues?
Well, World Health Organization is not doing politics. Our mandate is to support every member state, and we treat every member state in the same way. Our job is to provide the best possible science-based guidance to countries so they can tailor then their national responses to those guidance. So we will continue to do that. We will be working with everyone, with every country, with every population and community, trying to provide the best possible guidance as long as we learn more about the virus and as long as we develop solutions. And this is part of our mandate, to bring scientific community together to work on diagnostics, on vaccines, on therapeutics. So we will follow what is our mandate and what we are best for, and that's really a science and solution. And we will keep calling for solidarity among all countries.